we are hearing daily in the media and in reality from talking to people about things that are going really badly wrong in the NHS. But at the same time, we've got an NHS that still, for the most part, works for most people. Most people have a good experience of it. It performs hundreds of thousands tens of thousands of operations every year, millions of consultations each day with GPs and hospital clinics, and thousands of people every day getting care across the whole NHS, not just in hospitals but in the community and in general practice. So I think it's far too early to talk about the demise of the NHS, that it's to bury the coffin and all that. I don't actually believe that, and that's the experience I had in the street talking to people. I'm in the National Health Action Party. We were campaigning in London, I was standing in the Euro elections, and talking to people in the street, they said, oh, but I still go to my GP and I still get referred and cared for and I still go to hospital. And most people have good stories and some people have bad stories, which is also important. So, what is happening? At the same time you hear the head of the Royal College of Emergency Medicine and the Royal College of Physicians talking about severe crisis in our A&Es. A&Es are getting more and more chock-a-block. They can't move patients out of A&E into beds because there's been drastic cut in beds. Nearly all the reconfigurations that you hear about, not just in London but across the whole of England, all involve a net loss of beds. So there's a shrinkage of acute care. This is causing the A&Es, which is almost like a barometer of what's happening in the NHS, to get into crisis. People are waiting longer and longer. The 4-hour target is being breached more and more. Now, I'm not a great fan of these targets, but it is an indicator that something is changing. Then you're hearing that ambulances are then queuing for longer. They've got a target of offloading their patient within half an hour of arriving at the hospital. More and more ambulances are breaching the half-hour target. If ambulances are queuing up waiting to deliver their patients, and of course they're not available to attend the next emergency call, so you're seeing ambulances breaching their targets for attending emergency calls, and so it goes on back the way. Looking forwards into the hospitals, fewer beds, staff are being cut back. Staff unions and nurses unions and others will tell you that the staffing levels in many places are getting to be very dangerous. They don't have enough qualified staff to look after the patients. And from that you're hearing stories of poor quality care, which, okay, sometimes it's just people who are just not bad people, but in the majority of cases, that's even what the Francis report showed in his analysis of what went wrong with his staff, was actually underfunding and understaffing. So in the hospitals, the staffing pressures, quality of care pressures, patients cannot be discharged from hospital into the community, the ones that need longer term care, because of the massive funding cuts to social care, something like 20% cuts. Now that's enormous, and whether that's care in your own home or in care homes, all of that is being cut. There's a whole question mark anyway about the quality of care in the privatised care home sector, which is another whole story. But you can see there's a kind of crisis in the system. In general practice, where I'm from, everyone's moaning about not being able to get an appointment with a doctor for 3 weeks, but at the same time more and more pressure is being put on general practice. We have to deal with more chronic conditions than we had to 20 years ago when I first started out, actually more than 20 years ago. So we're dealing with a lot more, and so the demand is much higher, but we cannot provide the care we want to because there are not enough GPs. The Royal College of GPs estimate we need 10,000 more GPs. And there's been a real cut in the general practice budget of £1 billion since this government came into power. And we're seeing practices, I don't know what it's like around here, but in London and certainly in Tower Hamlets, I don't know if you know Tower Hamlets, a very, very deprived community in London, but with some excellent GP services that have totally transformed care there and really showing the way ahead for providing good quality care in deprived communities, are actually under threat of closure because of cuts to their funding. Really good practices may not, but that's unheard of. Your GP practice was always going to be there, wasn't it? It was good, it was bad, it was in between, but it was going to be there. Now there's a possibility it may not be there. Mental health budget, drastically cut. In fact, there aren't enough mental health beds around the country. People are sometimes having to be sent from, say, London up to Yorkshire to find a mental health bed. When you think what that is like for persons with mental health problems to be sent so far from their family and friends. Psychiatrists are saying that they're having to section people, even if they don't need to section them, because the person is voluntary admission, because the sectioning is the only way to secure a bed. And then we look at midwifery, we look at maternity, So there is bad stuff happening, and it's real, and that is happening simultaneously to the NHS on the whole being still managing to cope. Why? Because I would say it's because the staff in the NHS still working their socks off, many working longer hours than they're paid for. They've also suffered a huge effective funding cut because of the freezing of their pay. And it's that which has been the main method by which the government has taken money out of the NHS, is by freezing the pay for the staff. There was a £20 billion funding gap over the last 5 years, met largely through the pay, squeezing down pay. There's going to be another £30 billion funding gap till 2020. Something like £3 to £5 billion have been taken out of the NHS and given back to the Treasury already, not ploughed back in as it should have been. I would say that the funding crisis is one of the things that's almost like the Cinderella topic. We've all been campaigning about privatisation, and that is important, very, very important. We know privatisation, that was the main purpose of the Health and Social Care Act, to open up the NHS to further privatisation, to give Monitor the power to enforce that by challenging clinical commissioning groups if they didn't put things out to tender by to enforce competition. We know that something like £5 billion worth of NHS contracts have already gone out to tender, and of those that have been awarded, 70% have been awarded to private for-profit corporations. And this is, and the pace at which this is happening is accelerating. And we know the government is committed to this concept that private is best, despite the fact that there's no evidence that privatisation of healthcare systems is more efficient or improves quality. In fact, they cost more to run, so they're likely to reduce resources and make them less available to the front line. But you probably know all about the arguments against privatisation. What I think is a more complex picture is this picture of the deliberate running down of our NHS. If you've got a really good NHS, the private sector really doesn't have a look in. There's two ways you can privatise, aren't there? There's a privatisation of service provision, which is where companies bid to win contracts and get paid out of our tax money to provide services. The government tries to pretend that's not privatisation, but it is a World Health Organization definition of privatisation, public services being provided by private corporations. The other kind of privatisation is where people take out private health insurance or pay privately in order to get health care. That has been more or less static in the UK for at least the last decade, if not longer, the percentage of people who pay to go private. Why? Because you've got an NHS that on the whole provides good care. You can't really stimulate that the private sector where the big money is in private health insurance unless you actually start to run down and shrink what the NHS offers, and that's what you're seeing. Interestingly, with the Health and Social Care Act, you'll remember, it took away the duty of the Secretary of State to provide a comprehensive healthcare system. It devolves that duty to clinical commissioning groups who do not have to provide every item that you would expect in a comprehensive healthcare system. They actually have the leeway to provide just what they think is necessary. So there's a little bit of wiggle room there. And you may find that CCGs are going to start restricting what they actually are providing on NHS, which is another bit towards privatisation. So the running down of the NHS with underfunding goes hand in hand with softening up public opinion, that things aren't going well, it's in crisis, it's unsustainable, we need to do something, we need to get rid of the current model and bring in a different model. We need to get rid of what's called the single payer model, which is where the state pays, and bring in a multiple payer model, which is an NHS insurance company model, revenue takes out insurance. Now that is not an effective or cost-effective way of running a health service, but it's one that brings in profits to insurance companies, especially the American insurance companies who are eyeing up this European public services. And that's where I go on to TTIP. I was asked to say something about TTIP. Okay, does everybody know what TTIP is?